This is Gary Atensi with CNTV, and today we're in Lakewood, Colorado. I'm here with an insurance agent, Todd Vandehey. Basically, Todd, you've been providing insurance solutions for folks out there. You've just relocated to the area here as well. Let me ask you, first of all, what got you involved in this line of work?
Well, I've been interested in financial services for a really long time. I actually run a hedge fund as well, and I liked insurance in that it was a great way to help people, and it actually didn't conflict with running the hedge fund. So that's why I got into it in the first place. And then since then, I've just discovered I really like helping people, and I think that insurance is kind of the base of a financial plan. The first thing you need to do with your assets, the first rule of investing is just don't lose what you have. Right, and that's what insurance really is. It's about protecting what you have, and so that you have that security to allow yourself to grow for the future.
Let me ask you, for viewers out there, why do you think basically being able to sit down with someone and look at all the different possibilities, avenues, and solutions we have, why is that important today more than basically ever before?
Well, there's a lot of confusion in the health insurance in general. I mean, with all the new legislation and new laws, even some of the insurance companies don't know what the laws are gonna look like in a couple of years. So it's really important that you have up-to-date information. Also, we have dozens of carriers, hundreds of different plans. So there's certain plans that are right for one person that wouldn't be right for another person, and vice versa. Like maybe, say a young kid whose biggest concern is getting injured. He'd want maybe an accident rider and maybe a plan that he's paying less each month that just covers him for like the big stuff. Whereas someone who's a little older, they'd want a plan where they have some doctor visits, have a little more full coverage for prescriptions, that sort of stuff, things that they're actually going to use. So it really is important to tailor it to the individual so that A, they don't have gaps in their coverage, and B, they're not spending way too much money.
Wonderful. So we're talking about customized solutions here. You're able to listen to what their needs are and go from there. Obviously, it's a great advantage for you to be able to offer multiple companies and multiple different services to folks.
Absolutely. I think that way you can actually choose what's right for them rather than trying to push a product down their throat.
Excellent. Let's start off first of all with life insurance. Tell me what you offer there.
For life insurance, our carriers are Minnesota Life and ING, which are two very big reputable carriers. When we have term insurance, sort of to protect you for a certain period of time, which obviously costs less money. So it gives you just the protection. And then we also have whole life products, universal life products, which are more, they have an investment component to them, and they also last the entirety of your life. We offer that wide range so that we can protect you and also help your assets grow, like I said before.
So it really depends what your long-term goals are, how much you want to pay out a month, how much you want that going into something that maybe can come back to you, and so forth. Wonderful. What about in health insurance? Tell me what you got there.
Health insurance, we carry Anthem Blue Cross and Blue Shield, Humana, and then Golden Rule, which is United Healthcare. And so those are basically the three biggest carriers in Colorado, and actually the three biggest carriers nationally. In any case, three of the very biggest carriers nationally. So they have a huge range, a huge network. You can go to any doctor you want to, pretty much. Most of the big hospitals are in network, like Cedars-Sinai, Mayo Clinic, those type of places.
Obviously, going down the road a little bit, everybody's working hard to get to the age of retirement where we can all enjoy our dreams, enjoy a few things. Tell me what you have in the way of planning for retirement.
So we have a lot of our life insurance products actually have a lot of investment benefits, which are good for retirement. Another great thing that life insurance has for retirement is you can take money out of life insurance policies without paying taxes on it, because you can actually take it out as a loan. So it becomes a much more tax-efficient solution than many of the other retirement options out there. And then we're also going to be rolling out annuities in the near future.
Wonderful. Obviously, basically a lot of viewers out there want to protect their future, want to protect their retirement years and whatnot, but a lot of times life throws a curveball at us and we might need some long-term care. Tell me what you guys have there in that way.
For long-term care, we work with Genworth and John Hancock, which are pretty much the biggest carriers out there. And long-term care is a huge developing market because all the baby boomers are kind of aging into a certain age range where they're going to need that kind of help. And there aren't as many people sort of paying into Social Security, paying into Medicare for the future. So it's a huge need. In fact, there are the government's making huge encouragement. Even if you look at your Social Security statement, there's actually a part in there where they basically say that Social Security and Medicare do not cover certain long-term care needs. You may look into getting that kind of policy. So even the government is telling you, don't have enough necessarily to support that, you need to look into this. So it's a huge developing market, and it's something I think people are starting to look into it more, but there's a huge chasm of like people who just haven't looked into it, have never really considered it.
Very interesting. Let me ask you, Todd, obviously, let's say health insurance, for example. When a person has insurance, it covers all those bills that will come along if something should happen, especially major medical. But we also know there is things that happen that aren't covered, like basically life goes on. What do you guys offer in the way of supplemental?
So supplemental is one of the areas in which we're actually the strongest as a company, and supplemental insurance is so important. There's a statistic out there, I don't want to quote it exactly because I don't know the exact numbers, but essentially nearly right around half of the bankruptcies that occur, they occur for some reason due to healthcare costs. And of those, nearly half of those, right around that same number, actually had insurance. So either they were insufficiently insured or there were gaps in their insurance coverage. The other reason why people a lot of times have bankruptcies or have huge out-of-pocket health costs is because, yes, there's money for doctors, yes, there's money for hospitals, but there's also the hidden cost of healthcare, which is your missed work, you're having to cover your house payments, take care of your kids, feed yourself while you can't work, while you're undergoing chemotherapy or while you're in the hospital or that sort of thing. And so, yeah, we have a huge array of supplemental products. We have things that will cover you for, pay you money if you get cancer, stroke, heart attack, those sort of things. We have things that will pay you money if you're hospitalized due to injury. We'll pay you money if you're hospitalized for anything. So all of these things, and these products, they pay money directly to you rather than to the doctors or the hospitals. So it allows you that sort of, I guess, wiggle room to help you pay your bills and help you stay afloat during these calamities that can occur.
Wow, interesting. And a lot of times those supplements can be paid straight to the person.
Yeah, and supplement insurance in general, it does pay directly to the person.
Wonderful. Folks, once again, you can see his contact information on the bottom of the screen right there. Give him a call. He'd be glad to talk over any of the services that basically they provide. He is a licensed insurance professional here serving the Lakewood area as well as the surrounding area of Denver. Let me ask you last question, Todd. How important is that initial consultation when you sit down with a prospect and they tell you what they need?
Absolutely. It's so important. Everybody's different. Everybody's situation is different. Certain people have more money in their budget to spend on premiums. Certain people can cover a bigger out-of-pocket, so they don't need to insure as much. Certain people are more concerned about accident versus illness. It's just so important. When we go and visit with people, a lot of times we'll visit with people who already have health insurance in place. And it's amazing. Oftentimes, most people don't know what their coverage is. Most people don't understand their coverage. Things like the concept of coinsurance, a lot of people don't know what that means, and so they don't even know and so because of that, a lot of people have plans that are just really poorly designed for them. A lot of them they went on the internet and they just kind of threw a dart and saw what looks good as opposed to what's really right for them.
Wonderful. Folks, that's Todd Vandehey. He is an independent licensed insurance agent here serving the Lakewood area as well as the surrounding Denver area. Give him a call. His contact information is at the bottom of the screen. He'll be glad to sit down, show you all the different services and a variety of companies that he can basically put together a customized package for you that centers around you. This is Gary Atencio with CNTV. And if you don't know, now you know.